Hello, I'm Hannah Vivia. Welcome to Share. Well, most parents or guardians of young children worry when they get a note from the school saying that their child is misbehaving. The child might not be listening or is inattentive and distracting others. If the behavior persists, the child might be exhibiting signs of ADHD. Yet children can be fidgety and easily distracted without necessarily being affected by ADHD. With advice from professionals, we're going to find out exactly what ADHD is and what the various treatment options are, right here on Share. In recent years, ADHD has received better recognition. It is the most researched childhood condition, yet there is still a lot of misunderstanding about what ADHD actually is. We're now joined by Dr. David Ben, a pediatric psychiatrist, and Janine Shamos, who's a psychologist and SADC representative. A very warm welcome. Thank you so much for joining us.
Thank you.
Dr. Ben, I'd like to start with you, just about how much research goes into it, and yet still, even though there's so much information, yet there is still a lot of misunderstanding about ADHD and what it is.
Yes, and because it's such a complex condition, we don't understand it fully through the research either. And it's probably a group of conditions that look similar as well. And it has many implications. And just because you have ADHD, for example, doesn't mean you have to be on the medication for ADHD, but you may need other forms of management.
And one of the things that, I mean, one of the things we said in the intro was that the child might be, not behaving like they should in class. They might be distracting others. So what are some of the signs that would say, well, maybe you need to have this looked at?
Well, look, I mean, children will misbehave for many different reasons. You're having problems at home, for example. But if it's really affecting the child badly, if the child is suffering because of the symptoms, and also sometimes if their classmates are having a hard time because of the child's symptoms, that really is when you need some sort of intervention.
Janine, I want to ask you, where do you draw the line between a child being a child? Because sometimes you'll think about how you've taught in classes, how long a child has to sit and listen and not do anything and just absorb for that amount of time. Where do you draw the line between a child being a child and maybe a child having a problem that needs to be looked at, like ADHD?
I think from my experience, and I'm sure Dr. Ben can add to this, but from my experience, it's very much knowing the child as well. Speaking to parents, is this normal behavior? I find it very difficult to sit in one space and just absorb. If I'm doing something, I'm up and around and I'm doing 27 other things.
I think.
And I think we often misinterpret that as there's a problem instead of, well, I need a break from what I'm doing. But for a child to sit in class and just absorb, some children need to be moving, they're more kinetic, they need to be doing exercises, and that's how they absorb information. So it is important that we look at sort of holistic learning and look at the child holistically, what is going on at home, look at them in the playground. What is their behavior? Don't just judge it on one incident.
So I would ask you, Dr. Ben, is a parent gets this note saying, we're not able to manage your child's grades are doing really badly, they're suffering like you were saying. What is the first thing a parent should do? Because you were saying that maybe medication, you don't just rush into it, but what are the first things you would do for?
I mean, firstly, you listen carefully to what the teacher has to say. I think parents often struggle with that. And then look at what's happened in the past as well. And you may well find in years before there have also been similar issues, but they've been better managed, or they haven't been such a big issue because the demands weren't so great. And at that point, if you think your child is really struggling, and often, nobody enjoys getting bad marks, for example, even if there's bravado. So it's at that point that you need to start assessing, and it would depend on, where you go to depends on the child's age and what the child presents with. If there are learning difficulties, if they look like they're learning difficulties specifically, an educational psychologist is probably the person to start with. For younger children, occupational therapists probably.
Janine, sometimes though, for some parents, they might not be able to afford that, because if you're talking about an assessment, it can be quite pricey, whether it's an occupational therapist or whether you're going to a psychologist or even a psychiatrist. So what are some of the cheaper options that parents who might not be able to afford that option can take a look at?
Very importantly, I think, is information and education. So get as much knowledge as you can and information. Speaking to the teachers, give SADAG a call. We do always have support groups, university assessment centers that will do free assessments. So we do have options that money is very often an issue, and access to resources is an issue. So trying to link with organizations, link with your teachers, link with education specialists, and just try and get as much information as possible.
Dr. Bain, so now the assessment has happened, and the occupational therapist or the I don't know who would be the person most, I don't know if I can use the word qualified, to be able to say to you, well, your child does give you that diagnosis, your child does have ADHD.
Yeah. So, the final call is usually made by the medical practitioner, be that a psychiatrist or a general practitioner or a pediatrician or a developmental pediatrician. But really, the approach should be a multidisciplinary approach. This isn't an either-or. Very often, what the medical people do complements what the speech therapists are doing, what the occupational therapists are doing, and so people should be talking to each other. The professionals should be talking to each other when you're managing a child with ADHD and learning difficulties.
So once that diagnosis has been made that the child does have ADHD, then what?
Well, then then the question comes up of whether medical intervention would be helpful. At that point, you'll then need to see a medical practitioner who has expertise in the area. Not always necessarily a child psychiatrist, because there just aren't very many around. There are a lot of general practitioners, for example, that have expertise. But they also need to be speaking to the other professionals and getting their input. And then once you make the diagnosis, which really has to do with relative inattention, short attention span, being easily distracted, being impulsive, and then sometimes, and I think it's the least important, hyperactive. If you have those things and they're really affecting the child, that is when you consider a child of medication.
Janine, you were saying that one of the things that drives you insane is when a child is having these symptoms, you could call them, and then you look at what's in their lunchbox and they're taking to school, and that just enrages you.
It really does. I think it's again that multidisciplinary holistic approach that we need to start looking at ADHD along with every other mental illness or illness generally as not just you going to a doctor to get medication, but what is your diet doing? What is your exercise regime doing? What is the rest of your life? Kids who've been diagnosed with ADHD very often have low self-esteem. Very often feel that they've been labeled. That needs to be dealt with along with everything else. So it is really important that part of that approach and of getting the child onto a more positive track is looking at diet and looking at we are what we eat. We really are. We all have that, and it's no different in a child. So we do need to be looking at what are we feeding our children? When are we feeding them? What exercise are they doing? What stimulation have they got? Don't sit your child down in front of a TV and go, okay, bye. Get them out, get them exercising.
But one of the things that Dr. Ben was also saying was that that when you're doing the assessment, you might find that a child has got problems at home, and that's coming in. They've got this emotional overload, so their schoolwork is that much harder. So just speak to us about that, about the family life and how that dynamic can also play a role.
It's very important to understand that children, and I'm not just saying little kids. I mean all the way through to I went through to university. It's very difficult for kids sometimes to process or balance what's going on at home, what's going on in their own heads, and what's going on at school. And those demands are very difficult to balance. So it is important that we have parents working with teachers. And as Dr. Ben said, it's sometimes difficult for a parent to hear what a teacher has to say. We kind of go, my child's perfect, my child wouldn't do that. But maybe there is a problem, and we need to be working together and looking at, has your child gone through a trauma? Has it been a divorce? Has it been a loss of a pet? Have you moved house? Is that triggering something? Is there a learning disability that hasn't been diagnosed that's making it that much harder?
Dr. Ben, I'm one of those people that's not very into medication. So I think if I were told that my child had, that would probably be really last resort for me. It's not something that I would really want to do. But I remember speaking to a friend of mine who had said she had tried everything. She'd done the diet where her child would go to a party and he would go with his own, his own lunchbox and his own party pack because he couldn't have everything else the other children were having. She said she did everything that research told her to do that would make the condition better, and it didn't help, and eventually she did have to put him on medication. So let's just speak to us about that. That sometimes, I mean, I'm very anti, but then sometimes it could be something that your child needs to be on medication.
Absolutely. I mean, a high percentage of children with ADHD will respond positively to medication. You've got to balance the whole thing out as well. You don't want a child having more side effects than help from a medication. One of the big advantages of the ADD medications is that usually your little patients will tell you if it's working or not. It's very interesting. They often give you very, very accurate information. And I listen very carefully when children say they don't like it and that they have a problem with it, because very often they're right, and they may, they're often having quite significant side effects, for example, whereas they're much easily managed in class. The point is that the person that should benefit from being on the medication is the child, not parents, not teachers, anybody else but the child.
What do you mean by that?
Well, if you have true ADHD and you have a classical response to one of the medications, it's a bit like being a bit short-sighted and putting on glasses. You can immediately see much better, but you still have to do the stuff. You've got to read. You can put on reading glasses, and if you don't read, it means absolutely nothing at all. So it really enables the children. And enables them to focus. Most of them have a lot of trouble just staying focused.
I wanted to ask you, you had mentioned to me when we were talking about this initially before the program had started, you were saying that, again, one of the things that you want to be able to talk about is more holistically, but we're going to talk about that in a moment. Let's just take a short break. We'll be back just now. Well, many parents struggle with making the decision to put their child on medication for ADHD. When it comes to managing ADHD, is medication the only option? We spoke a little bit about that, but we will be delving more into more holistic approaches. Well, no loving parent wants to be judged on the decisions they make for their child, but many parents do feel judged when they inform others that their child is on a drug like Ritalin. Are parents fully aware of the ways that ADHD can be managed or treated? And we're speaking about that. And I suppose Ritalin is the one that people speak about a lot, but it isn't the only one.
No, in South Africa, Ritalin is one of three. There's Concerta as well. Has the same active ingredient as Ritalin, but it's a high-tech, slow-release capsule. And the third option is Strattera, which is very different to the other two. It's not a stimulant. It's much more subtle. Takes a while to work, whereas the Ritalin and the Concerta work immediately, usually.
So where is the judgment coming from, Janine, if the child is on medication?
I think very often, like even when adults are on medication, you kind of label and you're drugging your child because you can't control them. There's that kind of, well, my child also bounces around and I don't have to medicate them. I can deal with it. What's wrong with you? And that kind of feeling of, what am I doing wrong as a parent? Can I not manage this? Am I doing this for me? What is the problem? And I think that misunderstanding of what ADHD is, it's a real illness that needs to be treated. But that misunderstanding there of, it's bad parenting or it's incapable parenting really puts a strain on parents.
Dr. Ben, has the research showed us yet where ADHD comes from?
We know quite a lot about that. There's a strong genetic component to it, so that in practice means there's often a family history. So, for example, in a family where you have a chaotic, impulsive, disorganized child parented by a chaotic, disorganized, impulsive parent, there's chaos. And of course, it's going to make the child's issues worse. So quite often you need to intervene at that level, at the level of the parent as well. But in addition to the genetics, you need interaction with the environment probably to trigger the whole thing. And I think our school system is one of the triggers, because it really requires that children kind of sit and conform and learn in a particular way. And by and large, children with ADHD may be very bright, but just don't learn in the way that we teach.
And that has been, we were talking about Sir Ken Robinson, who has spoken about this so many times. I think his TED videos are probably the most watched. And it was just for me so interesting that is so true. But when you look at where we are right now with the education system, where you've got a teacher who's dealing with 35, 40, 40, sometimes 50 kids. That is where we are right now. So we're not even managing on just educating the kids in the mainstream way. What space is there to be able to say, well, this child learns like this and this child learns like that? You know, it seems like we don't have the capacity for that, Janine.
I think as an ex-educator, I think it's very important that we educate our educators. I'll give you an example, and he won't mind. I won't mention his name, but he won't mind. This was 10 years ago. I had a high school student who seating plan made him sit in the front, and he said, I can't sit. Can I stand? I said, stand on your head. As long as other people can see me, it's fine. And if he felt fidgety, he would stand and he'd be quiet, and that would be it. And we kind of did exercises. I taught English for a while, and I'd stand on the table and throw like balls to people and go noun, verb, adjective. And it just got a little bit more. It also was more interesting for me because instead of just going blah and receive. So I think it is important to empower our teachers to expand that. And we're not saying have a completely different teaching plan. You've got your own personality, you teach in your own way, but we can incorporate things into the system.
Dr. Ben, I was reading this You Magazine article, where these moms are completely outraged because their children had been misdiagnosed. They'd been diagnosed with ADHD, but the children were actually dyslexic. You were saying sometimes it goes hand in hand.
Yes.
But what had happened with these children is they were being medicated for ADHD. It didn't improve the situation because that wasn't their core problem.
Yeah. No, I mean, it's an important point, that, because about half of children that have ADHD also have non-verbal learning disability. So they struggle with written language, and it may be full-blown dyslexia, and it may not be. And they almost always need intervention on that level as well. So sometimes it's perfectly appropriate to be treating ADHD in children that have dyslexia. But as the two things often go together, they will also need intervention for the dyslexia and so on.
One of the things, I suppose, the government's credit is that you do get these remedial schools now that are public funded. They are much smaller classes, and in some cases with children that have got severe issues, coming from home, and that's impacting their schoolwork, they'll have therapists for them. Would you say, Janine, that perhaps we need to have more such schools?
Absolutely. I think we need to have more education generally, and more. Most children aren't going to, having 50 kids in a class is not optimum for any child, ADHD or not. So, I think more schools generally, and we talk about inclusive learning and getting kids with disabilities as well into so-called normal schools. It doesn't always work. So we do need to be sensitive to a child's needs, because ultimately we want them to reach their potential in the best way possible for them.
And sometimes I would like to ask you this, Dr. Ben, is that if a child does have ADHD, that label on them, that could be quite a negative thing for them, to think that, well, I've got this condition. So how do you do it that, well, you know what, it's the same like you're saying, mommy has to wear glasses, and glasses help me see better. Yes. It doesn't mean that I'm less of a person.
Yes, exactly. I mean, really, I do actually have a bit of a problem with calling it a disorder. It's really just a difference. I often explain it to the children. By the way, I speak to the children about this. I don't say, take this pill from your mum. I try to explain things to them. And it's very useful. The glasses analogy is that if you need reading glasses, you put them on. The other ways of dealing with it, you get books with huge type print and that sort of thing as well, and it'll be easier to read, but it's actually better to wear the glasses. But then you have to actually read. So if you focus better on your ADD medication and you do better at school, it's because you've been working, because the ADD medication is helping you focus, but you're doing the work, so you are doing well, and people will accept that.
And when you say that, I mean, the friend that I was saying to you had tried everything and eventually had to put her child in medication. He has done brilliantly at school, ended up being in leadership at the school, and does very well at sports. So not less that, he just knew that this was something that he needed.
I think it's very, very important that we do tell children what's going on. Don't just feed them something or change their diet or make them do, activities. They need to be part of that. And, you know, not as in, there shouldn't be this bubble of, oh, well, you're ADHD, you don't have to do that. You know, it should be, well, you just learn differently and you process things differently, and great.
But you said that you would get some times where you'd hear adults saying, well, because my child is ADHD, you know, you can't be too hard on them, or you know, where that I would imagine would also be a problem.
Absolutely. You know, I think with anything, I work a lot, some of my main focus is in prison. I work a lot with physically disabled children, and it's not, oh, well, you're in a wheelchair, so you don't have to be, you can be rude to people. No, that's not an excuse. You have something that is different to other people, doesn't take away from the fact that you need to be nice and polite and work hard, and we need to instill those values.
Dr. Ben, what is the one thing, I have to ask you this, what is the one thing that you would like people to know about ADHD, where you feel that we can't leave this conversation, you know, without people knowing this or thinking about that?
Well, yeah, it's a good question, that, and I mean, there are a lot of things. But what I would like people to take away from what we've talked about today is that if a child is, whatever you want to call it, misbehaving, doing what they shouldn't do, not doing well, etc., ask yourself the question, why is this happening? Don't ask yourself the question, is how do we stop this happening? Because that's the most likely way you'll get to a solution. And ADHD may be part of it, but there are also a whole lot of other things. You know, we spend quite a lot of time punishing children for making mistakes, and it's completely illogical. You punish somebody for doing something wrong deliberately, yes. And so, you know, they're not excuses for things. We all have to take responsibility for our behaviors. But in the end, you need, as a parent, to ask yourself why.
And you know, I would imagine also one of the things, and being a mom, we were talking about this before, is sometimes we punish kids for being kids.
Absolutely. We do, because we forget that they're kids. And kids do stuff, and they do silly stuff sometimes. All kids do, and they should. But we need to, I think it was Einstein, I might be wrong, who said a man who never made a mistake never made anything. We need to make mistakes. We need to mess up. Allow your children to mess up sometimes. It's okay.
Janine, Dr. Ben was saying that one of the things that he would like for people to take away from this, you know, is that when they see all these symptoms that we've spoken about, the very first thing they should ask is why. What is the one thing that you would like for people to take away from what we've discussed today?
I think the primary issue is talk to your child. Whether it's your child, whether it's a friend's child, whether it's a child in your class, talk to them. They will tell you how they're feeling. Children are incredibly honest. Talk to them and then get information and get help.
Dr. Ben, when she talks about that, children will tell you sometimes, can they always articulate what's going on? How do you decode?
They will have more difficulty than adults, I think, in expressing themselves. But it can be very helpful if you're an understanding parent to suggest things to children. Maybe you're unhappy because this has happened, because you're not reading as well as your friends, because... that way you don't put words into their mouths, but that way you will often articulate something for them. But if you listen carefully to the children, they'll tell you.
And Janine, one of the things for teachers is don't medicate the kids.
Please don't. It's illegal, and you don't know what you're doing, and leave it to the experts.
And do you find that, though, Dr. Ben, that sometimes teachers will take it and say, well, you know, the child is misbehaving. I've written 1,000 notes to parents, and they're not coming back to me, and I do have this stashed in my drawer.
I think it does happen occasionally, but it's very dangerous because it's illegal, apart from anything else. And you know, some people have very bad reactions to drugs.
And one of the things I would you know, that I would like us to end with is just that, like you were saying, you know, it's got to be parents, teachers, doctors, everybody coming together.
Yes.
And what do parents do when they feel pressurized that their child must go on medication?
Well, I mean, you know, especially if your child is having specific learning difficulties, you're going to go and need to see a professional. But you then listen carefully to what this person has to say and approach it skeptically. That's fine. Because these things are really complex. Sometimes parents go to various different professionals who don't talk to each other, who appear to be giving conflicting advice. That is terrible for parents. So it's much better to have one central person that is sort of the case manager who will liaise with other professionals.
Thank you so much for joining us. I think we've given quite a bit of insight to parents that might be going through this. Well, circumstances might not allow for a parent to put their child into therapy. It may be too costly, or it may be about logistics. Whatever the therapy or medication, when treating a child properly, a child diagnosed with ADHD can lead a very productive life full of success. Well, stay with Share for more programs that we'll be bringing you on mental health.